And we're ready for another session of our Holistic Health Hour. Remember, we got a lot of questions that came in, um, so we'll have those to go over. But if you do have questions that you want to chat in, hopefully we'll get to those as well. If not, hopefully we'll make those next week. Sometimes when we get chats in, I don't always get them, so I do apologize in advance that I don't see your chat questions. So just remember to always go on our site, the Holistic Health Hour.com site, to see, to post questions as well. And go to our blog post on connersclinic.com, CONNERS clinic.com, where you can search for questions on our website. We have well over 1,000 blog posts. You go to our YouTube channel too, and our new video channel, which is videos.connersclinic.com. We have well over 1,000 videos too. So we'll try to get your questions answered any way we possibly can. But anyhow, let's jump into this. First question. I have thyroid antibodies. I have had thyroid antibodies for 30 years, chronic Lyme and mold colonization. I'm a naturopath, so done a stack of cleansing. I don't appear to react to immune stimulants such as cat's claw, astragalus, andrographis, and echinacea, although I take the latter two less frequently. So I'm not sure what this person means by that they don't react to it, whether they don't react negatively or it doesn't help them from a positive standpoint. I use AO bioresonance and have come up with high ochratoxin and some citrinin and MPA. Those are all mycotoxins. On a mycotoxin test I did 6 months ago. I'm impressed by your acute, chronic, and AI products. Those are products that I formulated for autoimmune issues and Lyme conditions. And question, which of these would you believe would be beneficial? My scanner on the bioresonance is consistently telling me that I need antimicrobials and Artemisia annua as well as mushrooms. Okay, so it's a long question. First of all, if a person has thyroid antibodies and you're still showing TPO or thyroglobulin antibodies, um, that means that you either have um, Hashimoto disease or Graves' disease if it's in a hyperthyroid state. I assume um, that it's a hypothyroid Hashimoto's. If that is still true and you still show positive antibodies to thyroid, this is 30 years going, um, and you're still having issues, that's why you're asking the question, I would suggest that you consider at least doing some other antibody testing. So when a person has antibodies to self-tissue, that means every time you stimulate an immune response, either artificially stimulated immune response from exogenous sources, and by this I mean that you're purposely trying to stimulate the immune system to kill, some pathogen or something, like you're taking vitamin C or you're taking some of these products that this person mentioned, cat's claw, astragalus, andrographis, echinacea. These are all immune stimulating herbs. So if you're taking immune stimulating herbs, so again, you're trying to stimulate your immune system for whatever reason from an outside in source, I mean, you're taking supplements to do that, and you have self antibodies, the danger of doing that is you will destroy self tissue. So remember, when you stimulate your immune system, either from an exogenous source, you're taking supplements to try to kill something, or from an endogenous source, meaning that your immune system is upregulated because you are exposed to a virus, or you get a cold, or you get a sore throat or something, and your immune system um, increases production of killer cells. You're going to kill that which you have antibodies against first. That's the whole idea of having antibodies. So if you have self-antibodies, meaning antibodies to self-tissue, meaning you have an autoimmune disease and you have an uptick of your immune system, you will cause more destruction of that tissue. So that's what you have to be careful about if you have an autoimmune disease. And this is a major, major mistake that people make if they don't know that they have an autoimmune disease, but it's never been discovered. Why? Because it's never been tested for. The only way you're going to know if you have an autoimmune disease is if you tested for self-antibodies. Now, it's fairly common that a person would test for thyroid antibodies, because if you're really going to do a proper thyroid workup, you're going to test for TPO and thyroglobulin antibodies, which that doesn't really account for anything, because even you can go to an endocrinologist for hypothyroidism and they never even test for antibodies, believe it or not, which is absolutely malpractice. But many times people don't test for other antibodies. I mean, it's not, they might test for ANA antibodies, which is a systemic autoimmune disorder. They might test for lupus. In other ways, they might test for antibodies to different viruses. Like, it's not uncommon to get a Epstein-Barr virus antibody test, but it is relatively less common that a person goes to a doctor, even a functional medicine doctor, and they do appropriate antibody testing. And I think that can be an error. I think it's always wise to rule out other autoimmune disorders, meaning that, do you have antibodies to neural tissue? Do you have antibodies to other tissues, so that you know if you do have an autoimmune disease, then you have to be careful in using different nutrition the wrong way. So I'm all for using herbals to stimulate an immune response to kill cancer, or to kill a chronic viral infection or chronic bacterial infection. But if you're doing that with a person and you have autoantibodies, I mean, you have antibodies to self-tissue, or you never tested for these, then you could actually do more harm than good. Because remember, every time you increase the immune response, either artificially through using herbals, like I said, you will kill that which you have antibodies against first. So I think you should test for that. So what should you use? I mean, the reason why I created that acute LX, chronic LX, and the AI products is that I really created them in the mind, if a person has acute Lyme disease or acute viral infection or acute bacterial infection, a chronic Lyme disease, chronic viral infection, chronic bacterial infection, that would be the acute LX and the chronic LX. And then the AI is if you're in the autoimmune phase. There's no immune stimulants in there. So if you're going to try to support your body when you have an autoimmune disease, you can't be using Th1 stimulants. You can't be using immune stimulants. So if you want my advice on what you should take, you should only take the AI product or something similar to that. You can look at the ingredients on our store site if you want to purchase something similar to that. If you have something similar in your cabinet, the idea is that you're not taking things that are going to be immune stimulants. My scanner tests that I need for antimicrobials. Well, again, your scanner might test for the need for antimicrobials, but your scanner cannot test for autoantibodies. So you have to be, I guess, a more broad spectrum practitioner in the fact that you're going to look at autoantibodies. So if a person comes up that they have a viral infection or a chronic bacterial infection, you still don't just jump on that wagon and try to kill that virus or kill that bacteria without looking at the bigger picture. You got to test for autoantibodies. And you already know you have thyroid autoantibodies. You just have to know that if you're going to take immune stimulants, you're going to kill more of your thyroid, and you could, even if it's been fairly balanced and you've been able to keep it in balance with what other things you're doing to do that, could throw it way out of balance. Artemisinin Artemisia annua, which is artemisinin, is an immune stimulant. So artemisinin is a great antiviral. It's a great product for chronic Lyme, but once chronic Lyme goes into that phase 3 and it's an autoimmune phase, then you have to be careful with artemisinin. Mushrooms are your safer bet because mushrooms are not direct immune stimulants. Mushrooms are more immune regulators, meaning if you need an uptick in an immune response for a period of time, it will help uptick that. If your immune system is already in a hyper-functioning state, in many cases with autoimmune disease, it will calm that down. So mushrooms tend to act more as an immune regulator. It is dose dependent though. More and more studies are coming out that different nutrients work in your body differently, dose dependently. So I would say if you're going to take high dose of reishi or maitake, it's going to be more of an immune stimulant. If you're going to take a lower dose of those things, it can act as a more immune regulator. Cordyceps and turkey tail are going to be more immune regulators. You'd have to go pretty high dose for it to be more of an immune stimulator. Okay, so I hope that helps. I didn't tell you exactly what to take, but really to do more testing, I think would be wise. Next question. Punch biopsy of husband's center cheek showed squamous cell carcinoma. What treatments can he have done for the cancer on his cheek and the cancer cells that have traveled to other parts of his body from the biopsy? Heard that Mohs surgery or radiation and chemo won't kill the cancer stem cells, and carcinoma will come back with a vengeance to that same spot on his face. Well, first I want to calm your heart that don't believe everything you hear, because though those things can happen. So let's explain this a little bit. So a tumor on a person's face was tested. Again, I'm just reading these questions as a chance to look at these. Squamous cell carcinoma, we have several different types of cancer, skin cancer. The most common three is melanoma, which is the most serious, squamous cell carcinoma, which can be equally serious, and then basal cell, which typically is not serious. So basal cell carcinoma, I have no problem with the person excising those tumors if they want to, even though I think it would be wise to try some topical things, because you could use a curcumin cream, you could use different essential oils on basal cell tumors, and you could have pretty good effects. And then you don't have any scars from excising those tumors. Squamous cell carcinoma is much more serious. Typically with squamous cell and with melanoma, they're going to do a surgery called a Mohs surgery. What a Mohs surgery is they take out everything that they can see visually. Now understand, cells are small. You can't see them, right? You're seeing masses of cells. That's what you're seeing. So even when a surgeon goes in and removes a mass, let's say it's a 6 centimeter mass in the liver, they can only get what they see, and then they take out a little bit more tissue so that they're hoping to get what is called a clear margin. That's what a Mohs surgery is. Typically, we're talking about skin cancer removal, is that they're removing it deeper than what they can see. Then they immediately send that to pathology. That's examined. If it gets, I think it's 3 centimeters of clear margins, then they call it good. If they're like, oh, it's not 3 centimeters clear margin, they're going to go a little deeper, look at pathology results. Oh, it's still not getting clear margins, they'll go a little deeper. That's what's called a Mohs surgery. That's typically done on a squamous cell or melanoma. With basal cell, I think they just go visually. But positives and negatives of that. The positives are that you're debulking a cancer. So whenever you're surgically removing a cancer, whether it be a breast cancer, you're removing a lump. So that's called a lumpectomy, or you're doing a mastectomy. You're removing the majority of visual mass. So the positive of that is that if you're going to do other things, whether it's going after the removing the mass or the debulking of the cancer. If you're going to do other things, then you reduce the load on your immune system. So if you think of it, if that my immune system, I'm going to try to boost my immune system to try to kill cancer, and I have this mass, whether it be a 1 centimeter mass that's maybe 2 to 3 millimeters deep in a skin cancer, or it be a 1 centimeter round mass in a breast, or a 2 centimeter round mass in my liver. Debulking a cancer is the term that we give that you're going in there and surgically removing everything that you possibly can. So the idea isn't just to remove everything, it's to remove what you're just trying to use your best common sense possible. So you remove what is visual, and and by removing that as much active cancer that you can find, the positive is that you remove the burden of your immune system to have to destroy that. So then you can work on stimulating your immune system to clean up any other cancer cells that you have. So like this person alluded to, what can I do to help with the cancer cells that have traveled to other parts of the body from the biopsy? So cancer cells that leave an original primary tumor and travel elsewhere in the body are called circulating tumor cells. So circulating tumor cells are cancerous in the aspect of they're not healthy cells, meaning with a healthy functioning mitochondria and a healthy functioning nucleus. They're damaged nuclei in the cell. They're traveling to other parts of your body, hoping to, like I always say, set up home and raise a family someplace else. That's what their purpose is. What cancer cells, what differentiates cancer cells from non-cancer cells is cancer cells, something got inside the cell. Something got inside the cell at some point in time and damaged the nucleus, so now it's in a state of rapid replication. Now, when cancer cells are in a state of rapid replication, they're replicating unhealthy cells that are also have that damaged nucleus and are rapidly replicating. So when you see a cancer that is 1 centimeter large, that's millions and millions and millions and millions of cells. So there's going to be cells that are given off long before you're even diagnosed with cancer. If you just go in for a mammogram and you find this little spot, it's a really little spot, so we want to do an ultrasound and maybe do a needle biopsy of the spot. Well, long before you do the biopsy, and long before this person did the biopsy of the squamous cell carcinoma on their face, they already gave off that cancer has already given off thousands and thousands, maybe millions of circulating tumor cells that are traveling throughout the body trying to grow somewhere else. Now, what's keeping that at bay is your immune system. So that's what's keeping circulating tumor cells at bay from setting up another place and growing again. Now, if it does that, that's called metastasis. Now, is there a risk? This person alluded to, what do I do to keep that at bay from other parts of the body from the biopsy? So that phrase, from the biopsy, could say, well, that's conspiratorial. There's no way biopsies cause an increase in increased risk of metastasis. But actually, there is documentation that does show that does happen. There's a couple articles that were written a few years ago, and the ones that I looked at were on breast cancer biopsies, and it does increase the risk of metastasis. But I will say skin cancer biopsies, when you're biopsying the center, a punch biopsy of the center of the tumor, your risk of increasing circulating tumor cells from the biopsy is much smaller than what was documented as a needle biopsy possible complications from breast cancer. Because when you think of it, you're sticking a needle into the breast, depending on how deep that tumor is, you're going in there, excising some cells through the needle, but then you're pulling the needle through that breast tissue. The closer the tumor is to the surface, the less risk you have of spreading cancer throughout the rest of the breast that you're pulling that needle back out through. So the deeper the tumor is, the greater risk you have of increasing the spread of the cancer. So with a skin cancer, obviously, you're not spreading it through any tissue that is not cancerous. So I don't think that I would be worried about the circulating tumor cells from the biopsy. However, that being said, what I said previously, by the time you have to the time you have recognized that something is wrong and you have to go in and get it checked, you've already, your body has already given off tons of circulating tumor cells. From a from a medical standpoint, no, they don't do anything for circulating tumor cells. From a functional standpoint, you can actually measure circulating tumor cells, but it's only going to measure the circulating tumor cells in the blood. It's not going to measure circulating tumor cells that have already settled somewhere in the tissue. So I don't even particularly like that test because it could give you false hope that, oh, my circulating tumor cells are zero, so yeah, I'm in the clear. No, that doesn't actually mean that. However, so from a functional nutritional standpoint, what do you do for circulating tumor cells? Probably the number one thing that you would do for circulating tumor cells is modified citrus pectin. So there's a product called Pectisol C. That's a modified citrus pectin. Don't just get something that says citrus pectin. Certainly don't get something that says pectin. It's modified citrus pectin, Pectisol C. I write about it in my book, Stop Fighting Cancer, too. And you could look at it on our store. I probably have multiple articles on our blog on modified citrus pectin. So look that up. That wouldn't be the way I would actually treat the squamous cell, but it will help with circulating tumor cells. And that was your question. So as far as treating the squamous cell at our clinic, we get a cheek swab, we test for what we think is the cause, how to deal with that, and we test for what we think is going to be the best attack of the cancer. And plus, I would definitely consider getting it right. I mean, squamous cell could be as dangerous as melanoma, so it's not something to play around with. You want to get at it as fast as you can. So in this case, I would highly suggest you go on our website and schedule a case review with me, and we can discuss different options. Okay, a lot of time on that question. Is there any remedy for bone marrow injury where you don't make B cells anymore due to drug toxicity, chemotherapy, and rituximab? Right now, I have to go in for IV infusions of gamma globulins to replace my old immune system. I don't want to do this the rest of my life. Yeah, that is very hard. You're trying to renew tissue, and there's some nutrition that you could do to help with bone marrow production. I'd have to think about that a bit. Honestly, I don't have that on the top of my head. Again, probably schedule a case review with me because we could look at a nutritional approach for this. But it's just going to be supporting that, and I presume you're getting these measured when you go in, so you could test and see whether a nutritional approach would help. But it is part of the danger of doing chemotherapy. I mean, you damage other tissue, and the most susceptible to damage are tissue that is highly metabolic, cell lines that are highly metabolic. That's your immune system is a cell line that's highly metabolic, and your hair follicles are highly metabolic. That's why when people go and do the chemotherapy, they lose their hair because it's your chemotherapy is going to have predilection towards higher metabolic cell lines, which is good because that's what cancer is, and we want it to attack the cancer, but it also attacks those other cell lines, so it can really damage our immune system response. And that's why when you go in for chemotherapy infusions, they have to test your white blood cell count because typically you have a diminished white blood cell count because you have a diminished ability to make white blood cells. Next question. Do you have any help for my 33-year-old daughter with insulin resistance? She does not have diabetes, but has several female problems with PCOS and endometriosis. So, so insulin resistance, you can have insulin resistance even with somebody who's not overweight, even with somebody who has had a good diet. Meaning that they're not like a sugarholic. I mean, typically you think of somebody with insulin resistance, they're pre-diabetic or they're diabetic, and it's because they've been eating a really poor diet. Now, I have no idea if this person's been eating a good diet or not. But those are the kind of things that you want to look at. Insulin resistance is damage to partly the insulin receptors, the cell membranes, partly has to do with pancreatic function. And it has to do also with, it does tie. So it's interesting, this person said it's got several female problems with PCOS and endometriosis. I would definitely run some labs. So a Dutch test for sure is in order with this. And a Cyrex Array 5 would be appropriate for this. You gotta do some investigation. So with anything, when you're talking about, oh, why do I have insulin resistance, or why do I have PCOS, or why do I have endometriosis, you need to go to a doctor who's asking those questions. Why do I have this? Let's investigate. A few weeks ago, we had some questions on like, well, what's your protocol for this? Or what's your protocol for this? And I sounded like a broken record because I don't have a protocol for that. We have to find out why you have that. So these disorders or dysfunctions that we often call diseases are really, signs that something else is going on. So PCOS and endometriosis and insulin resistance are signs of other things going on from a metabolic standpoint. So we got to dig in to find out what the reasons why those are. And that's where we have to run some tests. And I know some people are like, oh gosh, these tests are expensive. Okay, well, you're never going to get to the root of things unless you dig in and figure this out. So I would definitely run some tests. Definitely our chronic disease and autoimmune course would be good. And a good, a case review with me would be a good thing to do too. Next question. Do you know anything to help with tinnitus? I have tried several natural methods with no avail. It seems there's nothing from conventional medicine. Yeah, tinnitus, there is no easy fix for tinnitus, because tinnitus is now thought to be actually inflammation and damage of the auditory nerve, and inflammation. It can be inflammation in the in your brain. So there is I have a blog post called, if you go to our blog and you look up neuroinflammation, I created a video. It's about a half-hour video on neuroinflammation and microglial priming. Highly suggest you go and watch that. What does it have to do with tinnitus? Because if you have inflammation in the temporal lobe of the brain, that's the sides of the brain, that's what your auditory center goes into. If you have inflammation and microglial priming in there, that can be a cause of tinnitus. So treating tinnitus as an inflammatory disorder is probably your best bet. So going on higher dose flavonoids, I would give that a try. I would also give a try to delta tocotrienol, which is the center portion of the vitamin E. There's 4 central components of that. Those are called the tocotrienols. Delta tocotrienol can be good for the ear. So not to get too technical, but you have certain parts of your body, you have vascularization, meaning vessels that are feeding it, and that's your source of oxygen to that tissue. Those vessels are what are called terminal vessels. So terminal vessels means you only have one vessel that goes to that area. You don't have other vessels. When you have tissues that have other vessels, those are called anastomosing vessels. So you have other sources of fuel, in this case oxygen, to that tissue. Well, in the inner ear and in the heart, you have, that's two main parts of your body that you only have terminal vessels. And when you have constriction of those vessels, that's usually due to inflammation in the underneath the lining of the vessel, which is the endothelial layer. You have smooth muscle, and you can get inflammation in there and cause contraction of smooth muscle, and you have contraction of those vessels, and you have an impediment of flow through that vessel, which causes a lack of oxygen, which can cause damage. If it's in your heart, you end up having a heart attack. Well, in your ear, you could end up with loss of hearing and tinnitus. So that can be an issue. Well, the delta tocotrienol, which is that center part of the vitamin E, can be very helpful to help open that up. So I would try delta tocotrienols. And so remember, it's not just vitamin E, because that's going to be a alpha tocopherol or alpha beta delta tocopherol. That's not what you want. So you want the center part of the vitamin E. I would also watch that video on neural inflammation and microglial priming. That'll explain calming down the inflammatory cytokine response in the brain, which could be in the temporal lobe causing the tinnitus, which you'd use high dose flavonoids, flavonoids are like curcumin, quercetin, bromelain, stinging nettles, anti-inflammatories, resveratrol, EGCG, things like that. So watch that video. That may give you some clues too. What do you recommend as the top healing strategies for severe rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease, so you have to dig in to find out what the triggers are. Are there food triggers? Typically, the food triggers pretty much across the board with rheumatoid arthritis are lectins. So definitely gluten, maybe dairy, but lectins. I would join the chronic disease and autoimmune course. It's $50 to join that course and start working through the videos on that course. I go into agonizing detail of finding your triggers in an autoimmune disease. So if you don't find your triggers in your autoimmune disease, you're not going to get better. So it can be something, like I said, typically with rheumatoid arthritis, you have to stay away from lectins. But there's very commonly multiple triggers. So I've had people with rheumatoid, I stopped lectins, I stopped gluten, that really helped me a lot, but I still have these flares. Now you start looking for triggers and putting on your Sherlock hat, and it's like, every time I go, outside with in high pollen times, that is a trigger for me. So everybody's triggers are going to be different. Remember, every time you have autoantibodies, that's what any autoimmune disease is. When you have antibodies to self-tissue, every time you stimulate your immune response, you're going to kill that which you have antibodies against. So you're going to flare your autoimmune disease when you have any trigger in your body that stimulates an immune response. So even, chemicals, toxins that you breathe in that can stimulate an uptick in immune response, you're going to feel worse. So you've got to figure that out. And you could do tests. You could do antibodies to different chemicals. You could do antibodies to foods, because it can be some weird component in a gluten-free product that you're eating. You could do antibodies to microorganisms, biotoxins. You can test for those things. If you have antibodies to Epstein-Barr, let's say, every time you're going to be exposed to that, again, which is pretty much ubiquitous, it could cause a flare, and that could be your trigger. You got to figure that out. So highly recommend you take that course. Just go to Connor's Clinic again. Top courses. It's cheap to do, and I give you a ton of information on how to self-help yourself through those things. You can order labs from the course. It's highly beneficial. So I'm not pushing it. You certainly don't make a whole lot of money on it, but I just am constantly adding new stuff to that course, literally weekly. So any new information that I come up with, I might make a video about it or a slide presentation about it or something and put it on that course. So do that. Next question. My 18-year-old daughter was diagnosed with stage 2B melanoma a year ago. We've been on a holistic health journey during this year, and her naturopathic doctor had suggested she do a liver cleanse. Her blood work showed elevated liver enzymes. My question, concerned about the protocol of the liver cleanse, to do a large amount of apple juice for the malic acid benefit, but will the high amount of sugar be bad for her as a cancer patient not wanting to feed the cancer? So doing a liver cleanse, first of all, I don't ever have any of my cancer patients do liver cleanses. And I wouldn't do a liver cleanse if my alkaline phos or AST or ALT came back elevated. I would try to figure out why it's elevated. Now, certainly, maybe this doctor did and came to the assumption that your congested liver. I'm not really big on liver cleanses, and the reason is that okay. So understand, in the liver, you have phase 1, phase 2, phase 3 detoxification pathways. These are controlled by different, dependent upon different nutrients and controlled by different genetic pathways. When we look at a person's genetic pathways, if they have issues with their cytochrome P450s or PON1 pathways, their NAT pathways and such, then we try to support those pathways. I go into detail on this in my book, The 7 Phases of Detoxification, and my course with that same name. So those 3 phases are 3 of the 7 phases of detoxification. Many times you have elevated liver enzymes because you have blockage downstream from that. So you have congestion of the liver, not because we need to do a liver cleanse, but we have congestion of the liver because of gallbladder issues. We have congestion of the liver because of issues in the gut. So we always want to start as far downstream as possible, which is what I call phase 6. Then we work up phase 5, phase 4, and then you are supporting those phase 1, 2, 3 pathways, not necessarily doing a cleanse. Now, the cleanse that this person's talking about using apple juice, I think I'm familiar with that cleanse. We even have information of that on our detox course, but it's really used to help with the gallbladders, helping to flush the gallbladder. So the question is really, should I be concerned with the sugar in the apple juice to feed the cancer? So I guess my answer to that question would be no, because you're doing this for a week, typically. So the apple juice and the malic acid content in the apple juice is to help soften the stones in the gallbladder. You may, prior to this, desire to get an ultrasound of the gallbladder to see what that looks like. That may be something you want to look at. But I would also investigate other possible reasons why those liver enzymes are elevated, because they should not be elevated in an 18-year-old person. So lots of times liver enzymes can be elevated due to even sensitivity to different nutrients. If you're taking high-dose nutrients, if the naturopath has put you on a bunch of different supplements that you may actually have a sensitivity to it. Remember, anything that you take in and absorb that your body can't use has to go through the liver to go through the detoxification process, phase 1, 2, 3, to get out of the body again. So anything that you absorb into the blood has to get out of the blood or be deposited in the tissues. And if it's something, even a nutrient that your body doesn't need, can overstress the liver. So one of the mistakes that I see with people coming to me with a cancer diagnosis, they're on, in my opinion, maybe way too much stuff, and too much of a good thing can be a bad thing. So other things that can raise most common things that can raise liver enzymes is a toxicity issue to a medication. So a person is on a medication, even Advil or Tylenol, that's a major issue of raising liver enzymes. So I'd be trying to investigate what's causing the elevation of the liver enzymes. Maybe you already did that. I don't know. You're just asking a simple question here. So to answer the simple question, would I be concerned about the glucose levels in the apple juice doing a week of the liver cleanse? I guess no, I wouldn't be concerned about that. But I do think it would be wrong of me not to give you that other information to investigate. Okay, next question. For a person with metastasis to the lungs, what are some ways to best support lung function? Dealing with wheezing, sporadic coughing, slimy phlegm. Okay, so there's some herbs that can help, certainly. Again, I don't know anything about this person at all. Was it metastasis from the liver? Was it metastasis from the breast? Well, what was? Remember, whenever you have metastasis of cancer, it's not a new primary cancer. So let's say you have breast cancer, it's metastasized to the lungs. It's not lung cancer. It's still breast cancer cells that are in the lungs. So breast cancer metastasized to the liver. It's not liver cancer. It's breast cancer in the liver. So, of course, you're doing everything you can to kill the cancer. So I hope that is a given. But what do you do for lung function is the question. You got wheezing, and coughing, and phlegm. Well, you want to make sure that you're expelling everything. So there's a purpose in a cough, and you want to be expelling that. So make sure the person stays healthy enough to be able to cough. Make sure they stay in a position where it's easy to expel that phlegm. That's important. There are some different herbs that can help with that. Lobelia is an herb that helps with the lungs. The first one that I think of always with the lungs is a medicinal mushroom called cordyceps. So cordyceps has a very strong lung support. It can even kill cancer that's in the lung, whatever type of cancer it is. But it's one of the best things to help heal the lungs. And then the anti-inflammatory, think of boswellia, curcumin, bromelain, ginger is very good for the lungs. And then there's some discrepancy of using glutathione and nebulized glutathione. Because it's cancer in the lungs, I don't think I would do that. I just wrote an article, so anybody who has cancer, I suggest you go to our blog post. I just did it either this weekend or late last week and posted it about harnessing the dose-dependent oxidizing effect of different nutrients to help kill cancer. So it explains that cancer cells, because they're in rapid replication, because they're not replicating really super healthy cells, especially mitochondrial healthy cells, they are more susceptible to oxidative stress. So I go into detail in the article, so I won't spend a lot of time with that, but you're at this level of, so when a cell is undergoing oxidative stress, it can kill the cell. So the oxidative stress, the negative of oxidative stress, it can cause damage to cells. It can cause cancer. So oxidizing agents toxins in our environment can be a cause of cancer. It could damage cell membranes. It could damage mitochondria of cell. It could damage other organelles in cell. So that's a bad thing. But cancer cells, because they're rapidly replicating, they're not replicating a healthy mitochondria, and it's the mitochondria that is mainly responsible for making glutathione in a cell, which glutathione is your main cellular antioxidant. So the glutathione is protecting the cell from oxidative stress. So in a healthy person, in a healthy cell, you could say we need more components for glutathione, which would be N-acetylcysteine, which would be taking glutathione itself, because it's going to help decrease oxidative stress on a healthy cell so it doesn't get sick, so it's able to make energy well. That's what mitochondria do. It's able to protect against cancer causing oxidative stress. But with a cancer cell, it's already making a lot of excess reactive oxygen species because of the nature of the cancer. And it's that you have like a lethal dose, you could say. So if you could put it on a bar graph, your lethal dose of oxidative stress, maybe right here. Well, a cancer cell is already functioning with their oxidative stress, reactive oxygen species just below that lethal dose. So if you could tip it over, that's really what chemotherapy does. Chemotherapy is an oxidizing agent, so it's adding reactive oxygen species to a cell to basically kill the cancer. Well, the idea is dose dependently, there's different nutrients that have been shown through different studies to actually be maybe antioxidants in a normal dose, but they're actually are oxidizing agents higher dose. So you're actually taking a higher dose of this to kill the cancer, to actually act like a natural chemotherapy. So go to that article. I talk about 4 different nutrients that work in that article, but the converse of that is true. Do we really want to use glutathione or N-acetylcysteine with people that have cancer? Because then could we not be keeping cancer alive by, it's really close to that lethal death that of reactive oxygen species, a lethal dose of reactive oxygen species intracellular. And if we give it antioxidants, could we be protecting the cancer cell and keeping cancer cells alive? Well, that's been a debate among natural and standards of care doctors for a long time. And I have fallen always on the side of, I don't think we should be giving cancer patients glutathione. But of course, we do testing in our office, so we do cheek saw testing. So we have a few patients that I do have glutathione, but not very many. So taking antioxidants, high-dose antioxidants for a cancer patient might not be the right thing to do. But if a person didn't have cancer, and the reason I'm talking about this is because glutathione and N-acetylcysteine are so good for the lungs and clearing out that waste of the lungs. But if they have metastasis to the lungs, then I'd say no on that. That's a long answer just to get to that point. But I think it's important. Next question. The doctor has prescribed a CT scan of the abdominal area for my husband. We know that the test involves some radiation. Are there precautions to take before and after such a test to reduce the negative effects? Thank you so much. So yes, a CT scan uses a lot of radiation. So out of all the, what are called plain film X-rays, or just a regular X-ray, if you went to a chiropractor and got an X-ray of your cervical spine, the highest dose X-ray is what's called a chest X-ray, because you leave the way it's set on the X-ray machine, you use more radiation. So you always measure the dosage, the rad dose of radiation that you're getting from something based upon a chest X-ray, because that was how they originally measured this. So yeah, CT scan is like getting 50 chest X-rays. So That's a lot of X-ray. So that's a lot of radiation that your body has to deal with. So what do you do? What do you do with all that radiation? Well, your body has to get rid of it, just like you have to get rid of, you know, you um, damaging effects of oxidative stress. So that's exactly what radiation is. It creates reactive oxygen species in your body, and you have to help get rid of that. Um, So I always recommend people that are doing a CT scan or a PET scan, because that's radiation too, to use our radiation homeopath. You can see it on our store. There's another homeopath made by Professional Health Products called Radialgin, I think it is, Radialgin. So I think if you just type in our store radiation, you'll see those two homeopaths that you can take. And I just go through the whole bottle of it and follow the homeopathic, follow what's on the bottle as far as how to take it. That can be really helpful with dealing with radiation toxicity. Okay, another question came in. As a patient uh, who's been using the Rife for 6 weeks now, I'm having issues with my colostomy liquid output for weeks, very foul, sometimes 6 a day. Could this be a part of detoxing? Trying to figure out why. Started a probiotic. Any suggestions would be appreciated. Okay, so whether you're having bowel waste come out of a colostomy tube and bag or into the toilet, you have to investigate, if there's a change in consistency, why that is. So certainly, um, uh, certainly looking at possible intestinal infection would be good. I wouldn't necessarily jump to like parasites or anything like that, but looking at infection would be very appropriate. Most common intestinal infection would be H. pylori, um, followed by other bacterial infections are not uncommon intestinal infections. Could it be something as simple as just imbalance and inflammatory process going on? Yes. So food sensitivities, gluten issues, dairy issues are your most common things. So looking at diet, investigating that, doing a Cyrex 2, Cyrex 3, Cyrex 4, or Cyrex 10 array would look at food sensitivities and things. You could certainly do a stool sample test. You want to investigate. So those are the things that you would look at for a change in bowel habits. What is going on? Certainly, if you don't have the finances to do the test, you have to experiment with maybe, uh, you know, a diet that's you're taking things out of your diet to see if there's something that you're eating that is causing this. Yeah, you have to do some trial and error on those because running some labs would be appropriate. I hope that your oncologist is recommending regular CBCs and complete metabolic panel, because that can tell you right there. If you do a CBC and you have white blood cell count that's over 7.0, they'll say it's normal, but you definitely have an infection going on somewhere. So, and then if your symptoms are bowel related, you could, make an assumption that maybe that's where I have an infection that I have to deal with. So, if you do have a bacterial infection in the gut, you know, from a medical standpoint, they're going to probably recommend antibiotics. If you do that, then you absolutely have to be taking probiotics. It's going to throw off your microbiota. But if you have if you're more inclined to do an alternative approach, thinking of like berberine and garlic and things like that would be more appropriate from a natural perspective to try to deal with this. Question come in from Facebook. What supplement is good for a person who is recovering from a heart attack? So a heart attack is kind of what we were talking about before, where you have an ischemic um, blockage of, you know, nutrition, oxygen to um, cardiac tissue. And you have to go, well, why? So it's easy to go, let's blame cholesterol. You have high cholesterol, you have cholesterol plaquing. But this is not always true. First of all, if you do have elevated cholesterol, you have to look at liver function. You might have you might have cholesterol plaquing and not have high cholesterol because you have damage to the arteries because you had high homocysteine levels for a period of time. You may have an ischemic attack because of what I said before. You actually have a deficiency in delta tocotrienols, and you have a contraction of your smooth muscle under the endothelial layer, and it was just a ischemic attack because of a contraction of that that's not a permanent contraction, but it's just damaging the blood flow for a very short period of time. So there's a lot of reasons why. So again, with treating anything, you have to try to treat the reason why. So you got to figure that out. But nutrition for somebody post heart attack, giving them cardiac tissue can be helpful to rebuild function. There is a product from Biotics called Cytozyme H that is cardiac tissue that is good for the heart itself. Looking at taking a full spectrum vitamin E. We use that for cancer patients and have private labeled a product called APOP E that has the delta tocotrienol in it, and then addressing the reason why by addressing either lipid issues or endothelial damage issues or chronic undiagnosed H. pylori or undiagnosed Lyme, undiagnosed heavy metal toxicities. Those are the three most common things that could damage endothelial cells and cause contraction of the smooth muscles and cause high blood pressure. So, all right, well, we have to sign off. So I have patients to get to. So thank you for being on. Make sure you go to our site called holistichealthhour.com, holistichealthhour.com, and go to Connor's Clinic and search for questions on there because we have tons of blog posts and you may actually find a question on there. All right, everybody be blessed, and we'll see you next week. Get your questions in, and hopefully we'll get to answer them. Thanks so much.